Good morning and welcome to the Fixed Ops Roundtable, Roaring Twenties event. The Leukemia and Lymphoma Society is the leader in the fight to cure blood cancer. It is the largest nonprofit dedicated to creating a world without blood cancers, having invested nearly $1.5 billion with a B in groundbreaking research, pioneering many of today's most innovative approaches. Their Dare to Dream project is the bigger, bolder next phase in their children's initiative. Dr. Louis DeGennaro is the president and CEO of the Leukemia and Lymphoma Society. He is a great friend of the retail automotive community, and we welcome him back. Dr. Lou, welcome to the Fixed Ops Roundtable.
Thank you, Ted. Really great to be here with you today.
And, Kara and I have been preparing for this event for a long time. You were with us last fall, and thank you because you really got our community kicked off between this event and the next one that we have coming up in November. Our audience is going to learn a whole lot about LLS and the Dare to Dream project. So if I may, tell us a little bit, Dr. Lou, today about Dare to Dream and maybe how that came about.
I'm happy to, Ted. As you said, Dare to Dream is the biggest, most bold program that I think the LLS organization in its nearly 70 plus years of history has ever attempted. Our goal is to completely revolutionize the way children with cancer are treated, to get rid of toxic chemotherapy that these children are given and replace it with modern 21st century medicines that kill the cancer, but you know what? Leave the rest of the child unharmed so they don't have any long-term side effects. In a nutshell, that's what Dare to Dream is all about. And I've challenged the team 5 years. We're going to do this in 5 years. This isn't, 20 years or forever. This is 5 years.
Wow. In 5 short years, everything's going to change.
Absolutely. Since you asked, Ted, let me tell you where it came from. This really takes the Leukemia and Lymphoma Society back to its roots. So I mentioned we're over 70 years old as an organization. We were founded by a father and mother who lost their 16-year-old son to leukemia. And honestly, their love of him, their grief, and their determination to never have another family go through the experience they went through was what brought them to found the organization and to set out on this pathway to cure leukemia initially and then all blood cancers. So this really takes us back to our roots, where we started as an organization, founded by a family for families to serve patients and their families. And we're gonna finally deliver on the goals and objectives of our founders.
Wow. And why do you think, Dr. Lou, that the needs for these children are different than, say, some of the adults?
Yeah, Kara, it's a great question. I think the easiest way to put it to you is children are not just little adults. They're not just miniature adults. And when they get cancer, they get a different disease than adults do. If you think, if as scientists, we look at the genetic underpinning of the disease, and it's different in children than it is in adults. The way children respond to treatment is different than adults do. So we need to design and develop new treatments that are specific for those children. The other thing is, today, most children are treated in a one-size-fits-all kind of protocol. We can do better, right? Again, it's toxic chemotherapy that they're given, and their little bodies remarkably can tolerate it, but it leaves them with long-term side effects, and that's the real goal of Dare to Dream. Get rid of those long-term side effects like memory and learning disabilities and motor coordination disabilities and heart damage that comes from the chemotherapy. We're gonna delete those. We're gonna get rid of those. So precision medicine, the right drug to the right child at the right time, rather than this one-size-fits-all current treatment that's in place, and getting rid of those toxic chemotherapies. That's what's different about this.
Wow. Dr. Lou, at this event, the Roaring Twenties, today, tomorrow, and Thursday, we're going to be challenging our automotive community, our family of dealers, our sponsors, our speakers to join us with LLS in the fight to cure blood cancers. And we're going to focus on Dare to Dream, the children's initiative. If you would, tell us maybe some of the ways that you help young patients and their families.
Thanks, Ted. This is really, really important. We've spoken so far about research, and yes, it's important to do this research and bring new treatments. But let's bring it back to the personal side. Hearing that your child has leukemia, that your child has lymphoma, that your child has a blood cancer, comes as a real, I said it a minute ago, a real kick in the gut for people. And there are huge implications there, right? Generally, because the child is going to be in the hospital for quite a long time, the current treatment regime takes 3 years. 3 years of constant visits to the hospital and treatments at home and so on. It's a tremendous financial burden, a time burden. We need to be there to support not just the patient, but the family as well. One of the caregivers generally has to leave work. The whole thing becomes financially toxic to the family. That's a time suck. So we're there to do these things as well. We're there to provide information, to provide financial aid, to provide guidance and support for the families undergoing this. We're there to hold their hand. We're there side by side with them. We help guide them to the right physician, the right clinical trial. Whatever they need, we want to be there side by side with them to help them. And that's the human side, that's the personal side of this kind of diagnosis and Dare to Dream.
So as you're helping all of these families, not just the patients, Dr. Lou, what would you say is the biggest need at LLS right now, and what will donations that hopefully we can bring on the Fixed Ops Roundtable help accomplish?
So lots of things. We talked a bit about research. Let's talk about that a little bit more. Something really remarkable happened in the 1960s with respect to childhood cancer. Pediatricians got together and they agreed to do two things. They agreed to run clinical trials with pediatric patients, and they agreed to share the information. And making that simple decision improved the survival rate from about 10% childhood leukemia survival to from 10% to 90%. Wow. Sharing information is incredibly important. It allows what we learn in one clinical trial can be built upon in the next one, and the next one, and the next one. That's how we got to 90%. We can apply that same thing here. And some of the dollars raised here for Dare to Dream will go to supporting a worldwide information system where physicians and scientists will be sharing information about their patients all across the world. This is going to accelerate how quickly we're able to get to this goal of a world without these blood cancers. So that's just one little snippet on the research side. And of course, some of the funds will go to help patients' needs directly. And I can't think of anything more important than supporting the patient while we help them through treatment.
Wow. We're so humbled to be able to work with you, Dr. Lou. We've met so many people whose lives have been touched. A young cancer patient comes to mind that Kara interviewed. It is Jude, who will be back with us between now and the next event. Everyone, I'm going to ask you, if you would, to get your smartphones ready, open up your cameras, and we're going to be putting a QR code on the screen. And you are going to see this throughout today's event, tomorrow and on Thursday. And please give generously whatever you can. The URL is fixedopscares.org. Again, fixedopscares.org. You can scan the QR code on your screen right now with your camera. That will take you directly to a webpage that is the Leukemia and Lymphoma Society. Your donations go directly there. They will support the Dare to Dream project, and we're going to ask you to give generously, whatever you can, whether it's a few dollars or whether it's more. You see, we've already got it up and running, and we're going to put this on the screen. Kara, I'm going to ask you throughout today and tomorrow and Thursday if you would share this with our audience to help support Dr. Lou and the great work that's being done by the Leukemia and Lymphoma Society for Dare to Dream. And Dr. Lou, we're going to come back and meet with you in November, because that entire event, that entire 3-day Fixed Ops Roundtable, Dr. Lou, is going to be focused on Dare to Dream. And we've got a great message, and we're going to ask our community to play a big part in marketing that and helping us, achieve our goal. And on behalf of the Fixed Ops and the automotive community, Dr. Lou, thank you so much for what you are doing.
Thank you, Ted. Thanks very much to your audience. We feel a real bond and a partnership with you all. I have to tell you that over the Labor Day weekend, I was at Lime Rock Raceway Park in Connecticut, my home state of Connecticut, watching the historic car races. And your background there with that 20s vehicle really kind of takes me back to that. There were some great historic cars race cars on display there at Lime Rock.
And we'll see a lot of that in this event. Dr. Louis DeGennaro from the Leukemia and Lymphoma Society here today at the Fixed Ops Roundtable.